what is eclampsia. So in detail we will discuss about the eclampsia. So first we will discuss the eclampsia and see the raising in the blood pressure during the pregnancy. We will call it as eclampsia. Then in detail we will discuss about the introduction, pathophysiology, treatment, and what management we can do for the eclampsia. So the introduction of the eclampsia is: hypertension is the most common medical problem encountered during pregnancy. Hypertensive disorders in pregnancy may cause maternal and fetal morbidity and leading cause of maternal morbidity. So uh, these can complicate and worse the situation for the baby and the mother too. Then hypertensive disorders are pre-eclampsia, then the eclampsia and the gestational hypertension, and next is chronic hypertension. So one by one we will discuss it all, but in brief I can tell you the short summary of these four hypertensive disorders. So what is preeclampsia? If the client or a mother or a patient, those who having the increased BP more than 140/90, we will call it as a preeclampsia. Then if the hypertension is accompanied with the seizures, so we will call it as eclampsia. And then next is gestational hypertension, is before like early in pregnancy, the if the hypertension is there, then we will call it as a gestational hypertension. And chronic hypertension, if the mother is having a regular or hypertension from the pre-pregnant stage, or that will continue, so we will call it as a chronic hypertension. Then next is definition of hypertension. Gestational hypertension, where what happened in this: Verdenus coined the term eclampsia, term for a Greek word meaning the light, like a flash of lighting. So what is the meaning of this eclampsia word? Is like a flash of lighting. The next is International Society for the Study of Hypertension in Pregnancy, defines as the occurrence of generalized convulsions associated with signs of preeclampsia during pregnancy, labor, or within 7 days of delivery, and not caused by epilepsy or other convulsive disorders. If the mother is not having any epilepsy or convulsive disorder, so during this duration, convulsions due to hypertension, we will call it as a eclampsia. Then next is preeclampsia, when complicated with generalized tonic-clonic seizures, convulsions, and coma, is called eclampsia. Then next is pathophysiology of this whole process. What happen in, like, the series of abnormalities takes place from the hypertension to the, like, further damage, what they will do. So first one is placental hypoperfusion. So first thing is, if the increase high in the blood pressure level, so it will leads to the placental hypoperfusion and decrease the perfusion to the placenta. Then next is constriction of small arteries. So what happens, due to the high pressures, the constriction of small arteries will be there. Then next is reduced blood flow to the multiple organs. Then it will like reduce the blood flow to the multiple organs, or especially to the vital organs. Then what it will leads to: increased vascular permeability. Then next, shift of extracellular fluid from the blood to the interstitial space. So that's why it will cause the swelling in the feet or the dependent areas. Then next is reduce blood flow and the edema. So that shift of fluid will leads to the blood flow and swelling. Then next is hypertension, renal, pulmonary, and hepatic dysfunction, and cerebral edema with cerebral dysfunction and convulsion. It will cause, like, these are the further damages done by these throughout this process. Then clinic then next is the clinical features of gestational hypertension and eclampsia. So what happen in all these process? So first thing, it consists of 4 stages, that are pre-monitoring stage. So what happen in the pre-monitoring stage? The patient becomes unconscious. There is a twitching of muscles of face, tongues, and limb. Eyeball roll or turn to one side and become fixed, and then this stage lasts for about 2 to 3 seconds. Then next is the tonic stage. So what happens in this tonic stage? The whole body goes into a spasm called trunk opisthotonus. Then next see. So the whole body goes in a tight muscle stretching. Limbs are flexed and hands are clenched. So as the picture has shown, the patient's body is stiff and tight. Respiratory senses and tongue protrude between the teeth. So what we can do during this stage is safety of the tongue and tongue fall we have to prevent with the help of this airway, or we can give the side position or aspiration we have to prevent during this stage. Then cyanosis appearance, so bluish discoloration over the feet, nails and cyanosis we can see during this stage. Then next is eyeballs become fixed during this stage of, then this stage lasts for about 30 seconds. Then next stage is clonic stage. So what happen in this clonic stage? All the voluntary muscles goes under alternative contraction and relaxation. The twitching starts in phase, then involve one side of extremities and ultimately to the whole body is involved. Then next is in the conversion. So biting of tongue occurs, so we have to prevent fall of tongue, biting of the tongue or any severe injury or complications. And then the airway patency is also one of the reason, one of the thing that we have to keep in mind while dealing with the patients. We can give the sideline position and allow the this seizures to stage to pass. Breathing in stenosis and blood stained frothy secretions fill in the mouth. Then cyanosis gradually disappear during this stage. This stage last for 1 to 4 minutes. Then tongue biting, see how severe tongue biting is there. Stage of coma. So following the fit, the patient passes on the stage of the coma. Then it may last for a brief period, or in other deep coma persists till another conversion. So the like if we will ask to the patient what happened during these things, so the patient won't remember what happened during this period. And the patient like patient is going through this thing, and they are complaining of pain all over the body, or whatever the damage like tongue bite or anything happens. So they can see and asking what happened, because they don't remember the whole process during of the seizure. On occasion the patient appears to be in a confused state following the fit and fail to remember the happenings. The fits, so as we have discussed, the patient won't remember what is happening during this stage, like this seizure stage. The fits are usually multiple, reoccurring at varying intervals. Then when it occurs continuously, it is called status epilepticus. So if the like recurrent seizures are coming, so we are using the term status epilepticus for this. Then following the convulsions, uh, temperature rises, pulse and heart rate rises, respiration rate increases, and blood pressure also increases. The urinary output is markedly diminished, proteinuria is pronounced, and uric acid is raised. So as we have already discussed the basic parameters of the what happens in the all the vital parameters are increased, and urinary output is decreased, and proteinuria we will found an increase in the blood urea level. Then next is other clinical features are, so what the initially mother is complaining about for this thing. First one is headache, then second is visual disturbance, then third is edema in the dependent area first, and then further in other parts of the body, high blood pressure or blood pressure more than 140 by 90, and the fluid retention, such swelling in the feet, or like very heavy foot you can see in the hypertensive patient during the pregnancy. Then the fundal height less than the approximate date. So as we have discussed already, or as we have already seen in how to measure the fundal height in the antenatal mother, so that is not appropriate to the gestational age of the baby. The next is what management we can do for the eclampsia. So aim of management is, first one is prediction and prevention. So early identification of the eclampsia and prevention of eclampsia is the best policy we can prevent, by like early detection and prevention we can prevent major complication or the life threatening things, or pregnancy losses, or any serious damage to the mother. So early prediction and prevention is the best policy for the management. First aid treatment outside the hospital. So already we have discussed, like giving sideline position to drain out the secretions, or providing the safety and safe environment, like if during the seizure the patient will not harm himself or herself. Then next is uh, airway prevention. Then next is prevention of further injuries like tongue biting and all. Fall prevention we can do. General management is so what we can do in general management is medical management and nursing management. Then specific management, one by one we will discuss it all. Then obstetrical management, so we will discuss one by one. So aim of management is arrest convulsion. So arresting convulsion is the aim of management. Then second is maintenance of patent airway, breathing and circulation. Then next is oxygen administration at 8 to 10 liters per minute. Then terminate pregnancy. So the if the mother is in completed already 36 weeks of pregnancy, so delivery is safe. Then if the mother is not completed, then we have to wait for 24 hour to 36 hour for the dexamethasone therapy for the lung maturity. Then next is ventilatory support if needed to the mother in severe conditions. Then prevention of complications. So then after the management, we have to prevent the complications like multiple organ failure or any organ failure. Then prevention of life threatening situations is one of the aim. Then postpartum care to the mother and baby. Medicine and regular follow up is very much essential for further prevention of complications. Or if the mother is chronic hypertensive, and we have to monitor because they are more prone to be hypertensive in their further life. Then next is prediction and prevention. In majority of cases, eclampsia is preceded by the pre-eclampsia. So early identification of the pre-eclampsia, we can prevent the eclampsia by measuring or regular examination of mother of like BP checking during each and every antenatal visit. Then this prevention of eclampsia, rest and early detection, and effective institutional treatment with judiciary treatment of pregnancy with eclampsia. Then next is use of antihypertensive drugs, anticonvulsant therapy and timely delivery are very important step for prevention and like for the prevention of complications, for the good health of mother and baby also. Then close monitoring during labor and 24 hour of postpartum are also important in prevention of eclampsia. Then unfortunately 30 to 85% of cases of eclampsia remain unpreventable. Then use of magnesium sulfate lower the risk of eclampsia. Then next is first aid treatment outside the hospital. The patient either at home or in the health center should be shifted urgently to the tertiary referral care hospital because there is no place of continuing the treatment in such place. Then next is transport of an eclamptic patient to a tertiary care center is very much important. Then such patient needs neonatal and obstetrical intensive care management, so we have to pre ready for that thing, because all these facilities are available in the tertiary centers. Important steps in transport are all maternal records and detailed summary should be sent with the patients, all routine investigations and whatever the ultrasound and everything we have to carry with the patient. Drugs should be established and convulsion should be arrested. So the magnesium sulfate therapy should be started as soon as possible. Drugs should be given like magnesium sulfate, labetalol, diuretics and diazepam. One medical personnel and the trained midwife should accompany with the patient in a well equipped ambulance to prevent into any complications. Then next is general management. What general management we can give to the patient is supportive care. Then aims to prevent serious maternal injury from fall, to prevent aspiration, to maintain airway, to ensure oxygen. So that already we have discussed how we can do for this, putting oral airway and keeping a patient in a sideline position to prevent the or maintain the airway and prevent this tongue bite. Patient is kept in rail coat and tongue depressor is inserted between teeth to prevent the tongue fall or tongue bite. She is kept in lateral position to avoid aspiration. Vomitus and oral secretions are removed by frequent suctioning. Oxygen is maintained through face mask to prevent respiratory acidosis. Then next is ABG analysis is needed when oxygen saturation falls between 92%. Soda bicarbonate is given when pH is below 7.10. Then next is history. Detailed history to be taken from relatives relative to diagnosed eclampsia during the pregnancy, number of fits, and nature of medication administered outside. Then what examination we can do for this patient? These the eclamptic patients. When the patient is stabilized, abdominal and vaginal examination are made. A self-retaining catheter is introduced and urine output should be monitored for the protein and the total amount of urine. So because whenever we are starting the magnesium sulfate therapy, for the urine output is very much important parameter for deciding the next dose of magnesium sulfate therapy. Then next is monitoring. Half hour pulse, respiratory rate are to be recorded, and hourly urine output is to be noted. If undelivered, the uterus should be palpated at regular interval to detect the progress of labor, and fetal heart rate to be monitored if bradycardia occurred. So we have to monitor the progress of labor also. Fluid balance ringer lactate solution we are going to give for this patient. An excess of dextrose and crystalloid solution is not to be given, as it will aggravate the tissue or overload, leading to pulmonary edema, circulatory overload, and acute respiratory distress syndrome, that is ARDS. Then antibiotics we have to start. Cefixime 1 gram IV BD we have to give. Then specific management we can give is anticonvulsant and sedative therapy we should start to prevent the further seizures. Then magnesium sulfate is the drug of choice for this. Other regimen are Finto and diazepam light cocktail Manon 1961 using chloramphenicillin or promethazine we can give. Then next is antihypertensive and diuretics. So drugs commonly used are hydroxyzine, labetalol, calcium channel blocker or nitroglycerin. Then next is diuretics in case of pulmonary edema. Furosemide is given in doses of 20 to 40 mg IV. Then next is management during fits. So what management we can give during fits? Status applicatives. If the repeated seizures are coming, thiopenton sodium 0.5 gram dissolved in 20 ml of 5% dextrose is given very slowly. Treatment complications of the treatment is prophylactic antibiotics we can give for pulmonary edema and ARDS. Furosemide 40 mg IV followed by 20 mg of IV we can give this. The next is for heart failure, dopamine infusion is given. For psychosis, chloraprazine and trifluorazine is quite effective. Then next is obstetric management we can give is fits control we can do. Baby mature, so we have to decide the baby is less than 36 weeks of gestational age or more than 36 weeks of gestational age. Then baby premature, if the baby is less than 37 weeks, so what we have to do, uh, we can start the dexamethasone therapy for the lung maturity. Baby is live or dead, then we have to identify. If it's not controlled, then termination of pregnancy. Low rupture of membranes is to be done for accelerate the labor. Then this is the total management of this eclampsia. And the source of the information is this is the textbook of obstetrician. So as everyone is aware about the, so like we are taking this, multiple websites are also used for this thing. So thank you for watching this video. Hope you like my video. Please do share and subscribe to my YouTube channel Nursing Crazies. So friends, please give your suggestions. So what topic you want next for the class. so I can get the idea. So what are the topics are needed for to be discussed for the further classes. Thank you for watching. So this class is after so much of a long time, so we have to discuss one by one. We have already discussed all the things which is related to uh, eclampsia. So please friends, give your suggestion what you like for further classes.